Hello parents, I'm Dr. Yatin Bhole. One very common and scary moment for parents is this. Your child has fever, the thermometer shows 101 or 102, and yet your child is shivering, teeth chattering, asking for a blanket, saying I'm feeling very cold. Parents immediately think, Doctor, fever is high, then why is my child shivering? Is something going wrong? Should I cover or uncover? Today I will explain exactly why children shiver during fever, in a very simple way. First, understand one basic fact. Fever is not caused by heat from outside. Fever is controlled by the brain. Inside the brain there is a small area called the hypothalamus. Think of it as the body's thermostat, like the thermostat in your AC. Normally, this thermostat is set around 37 degrees Celsius or 98.6 degrees Fahrenheit. Now, when a virus or bacteria enters your child's body, the immune system reacts. White blood cells start fighting the infection and release chemical messengers into the blood. These messengers tell the brain, we are under attack. When these signals reach the hypothalamus, the brain decides to increase the temperature setting. This is very important to understand. The body temperature has not yet risen, but the target temperature has increased. Suppose earlier the thermostat was set at 37 degrees Celsius. Now the brain resets it to 39 degrees Celsius or 40 degrees Celsius. At this moment, even if your child's actual temperature is already 38 degrees Celsius, the brain thinks, the body is still too cold. We need more heat. So the brain activates heat-producing mechanisms. This is when shivering starts. Shivering is not a sign of weakness. Shivering is a powerful heat-producing mechanism. When muscles shiver, they burn energy and generate heat. At the same time, the brain narrows blood vessels in the skin, so less heat is lost. That is why the child feels cold, looks pale, and wants to curl up. So remember this clearly. Your child is not shivering because the fever is coming down. Your child is shivering because the brain is trying to raise the temperature further. This is why shivering usually happens at the start of fever or when fever is rising. Parents often ask, Doctor, should I give blanket or not? During this shivering phase, giving light covering is okay, because the body is actively trying to reach the new set temperature. Do not aggressively uncover a shivering child. Once the body temperature reaches the new set point decided by the brain, shivering stops. Now the fever has settled. Later, when you give paracetamol, something different happens. Paracetamol blocks a chemical in the brain called prostaglandin E2. This chemical was responsible for raising the thermostat setting. When it is blocked, the brain resets the thermostat back toward normal. Now suddenly the body feels too hot. So instead of shivering, the child starts sweating, throwing away the blanket, feeling warm and flushed. Parents then say, Doctor, earlier he was shivering, now he is sweating. Both are normal, just different phases controlled by the brain. One more very important reassurance. Shivering during fever does not mean the fever is dangerous. It does not mean seizures will occur. It does not mean the child is deteriorating. It simply means the immune system and brain are actively working together. What should worry parents is not shivering alone, but persistent lethargy, difficulty breathing, poor drinking, repeated vomiting, or abnormal behavior. A child who shivers, then settles, drinks, and responds is usually doing fine. So the next time your child shivers during fever, remember this sentence. My child is not freezing. My child's brain is raising the temperature to fight infection. Understanding this will reduce fear, panic, and unnecessary overtreatment. If this explanation helped you, please like and subscribe so more parents can understand fever calmly and correctly. I'm Dr. Yatin Bhole.